Community Scotland, we are a homelessness organisation, charity. We're wholly focused on supporting people who are at risk of homeless and experiencing homelessness. So we're not a drugs service, we're not a substance abuse service. What we do though is work with people with very complex needs, and we work with people where homelessness is a consequence of a journey, and that journey, sadly for most of the people we work with, began in childhood. So we're looking at significant trauma and re-traumatisation. So by the time the people we work with in their early teens, alcohol, drugs, self-harm, mental health problems are huge issues in their lives. And we work with the adults and the consequences of that. Our challenge is in relation to the drug deaths in Scotland. I'm sure most of you know Scotland is the highest drug death rate in Europe. We had 934 last year, and it's set to rise again this year, unfortunately. I joined Simon Community 5 years ago. We had no drug deaths in our services. I apologise for the chart, but if you look to the red, it's twin axis, so we'll get drug deaths in the red and using a log zone in the blue. But last year we had 11 deaths, and this year we're predicting 20 within our services. During that time as well, we've been recording our use of naloxone and first response, and that has risen to 60 last year, and we've already surpassed it this year. And what I can say is in most of the cases where we're providing that first response, we are saving lives, and a significant number of those people would be dead had it not been for us responding to them. So that's the good news. If we know somebody's on an overdose, we have a response, and in the vast majority of cases we can prevent death from occurring. What we can't do is prevent death occurring if we don't know they're actually having an overdose, and that's where we find people in the morning in their rooms who've died overnight. So our challenge was to work with Carezapp to identify a way that we can be alerted to when someone is having an overdose, because we'll get staff 24 hours in services, and then we can send the staff to the room and intervene. So we're looking at putting in a non-contact system, 2 monitors. One will be a mattress monitor, but the other will be a radar, ultra-wideband radar, which will create, for the technical people amongst you, a Doppler pulse matrix, so it will cover the whole room, because people don't overdose in bed. We'll find them on the floor, we'll find them in chairs. So we needed a system that was able to capture the whole room, that recorded vital statistics, particularly breathing, so that when, I should say, all of this information is gathered real time into Carezapp's system, but it's simple enough that we'll send an alert to the staff's phone to say there is something happening in room 9, you need to go and check it out, so we can provide that first response and we can hopefully prevent someone from dying. And that is essentially what we're trying to do here. We're trying to find a way of alerting the staff to save lives. The other thing that we're doing is we're gathering a huge amount of data that we haven't been able to gather before, and we don't know where that's going to lead us in terms of understanding the physiology of an overdose, because this is recording all the time. We're working very closely with service users. They're fully involved in the process. Our service users have got significant risk issues. They're embarked in significant risk behaviours, and often not particularly careful about looking after their lives, so they know there is serious risk of death, and their friends and family have experienced that. So putting in a system in place which is passive as far as they're concerned, but allows us to actually work with them. So that's essentially what we're doing. We're looking at preventing drug deaths in our services by putting in technology in the rooms that will alert our staff to do a first response. Our pilot will begin next month, and we're working in North Lanarkshire, and hopefully by the end of the year we will come back and give some information on what we found, and hopefully we'll be able to saving some lives. Thank you.